Take a quiet moment with me right now. Think about your morning routine, the same glass of water, the same pills laid out neatly on the counter, the same medications you've taken for years, maybe decades, without a second thought. Not because you're careless, not because you're uninformed, but because you were told they were safe, approved, necessary, prescribed with good intentions by professionals you trusted. And here's the unsettling truth most people never stop to consider. Some of the greatest dangers to an aging heart don't arrive suddenly. They don't come with alarms. They don't cause pain right away. They arrive quietly, gradually, day after day, pill after pill. They slip into your life disguised as help. You don't feel anything at first. Your days go on as usual. You stay active. You take care of yourself. You do what responsible, educated adults are supposed to do. And all the while, deep inside your chest, your heart is working a little harder than it should. Struggling just a bit more than yesterday. Adapting. Compensating. Holding on. Because that's what the heart does. It doesn't complain. It doesn't ask for attention. It just keeps going. Until one day, it can't. What makes this especially dangerous is that these medications are not rare. They're not experimental. They're not hidden in some dark corner of medicine. They're common. They're familiar. They're often recommended with the best intentions to ease pain, protect your stomach, help you sleep, manage everyday conditions that come with age. And that's exactly why they're so easy to trust. You're not reckless. You're not ignoring your health. In fact, you're probably someone who prides yourself on being careful, on following advice, staying informed, and doing the right thing. But even responsible people can be vulnerable when trust goes unquestioned for too long. Because the kind of heart damage I'm talking about doesn't happen overnight. It happens slowly, silently, over years. It builds in the background while life feels normal, while checkups seem fine, while no one thinks to look deeper. And when it finally shows itself, it often does so suddenly, at a moment no one expected. So let me ask you something honestly, without judgment, without fear, just awareness. When was the last time you truly questioned a medication you've been taking for years, not glanced at the label, not assumed it was still necessary, but actually stopped and asked yourself, is this still the right choice for my heart? At this stage of my life? If you've never asked that question, you're not alone. And that's exactly why this conversation matters. Let me tell you why I'm speaking to you about this. I'm a heart surgeon. I've spent decades inside operating rooms, watching hearts up close, strong ones, fragile ones, and hearts that were quietly worn down over time without anyone realizing it was happening. I've worked in some of the most advanced medical centers in the country. In Manhattan, New York. In Palm Beach, Florida. In Beverly Hills, California. Places where people have access to the best doctors, the best hospitals, the best care money can buy. And here's what may surprise you. Many of the patients I treated were not careless with their health. They were retired executives, business owners, attorneys, engineers, people who planned their finances, their futures, and their retirements carefully. They exercised. They ate reasonably well. They went to their appointments. They followed instructions. They did everything right. And yet, they found themselves sitting across from me, stunned, asking the same question in different words. How did this happen to my heart? When we looked deeper, past the obvious causes, it often wasn't genetics. It wasn't reckless living. It wasn't bad luck. It was something far more ordinary. Medications they had trusted for years. Medications that were approved, prescribed, renewed again and again without question. And that's why this conversation matters. Before we go any further, I want to hear from you. Because this channel, Ever Young Seniors, is built around real people, real lives, and real experiences. Take a moment and leave a comment with two simple things: your age and your city and state. Just that. I read these comments personally. They help me understand who I'm speaking to and what matters most to you. They also help shape the future videos we create here for Ever Young Seniors. And if you're hesitating, wondering if you're the only one, let me reassure you, you're not alone, not even close. So as you think about that, let me ask you something gently, honestly. How many years have you been taking your current medications without a full, heart-focused review? Not a quick refill, not a routine visit, but a real conversation about how those medications interact with an aging heart. Now, here's what I want you to know before we continue. This is not about panic. This is not about fear. And this is absolutely not about stopping any medication on your own. What I'm going to share is about awareness, about understanding, about knowing when it's time to reassess decisions that may have been made years ago for a very different version of your body. In the next part of this conversation, I'm going to walk you through 4 very common categories of medications, 4 types that millions of seniors take every day. Each one affects the aging heart in a different way, some subtly, some more aggressively, and all in ways that deserve a closer look as the years go by. My goal is simple: to give you knowledge, so you can ask better questions, have better conversations with your doctors, and make decisions that protect not just how long you live, but how well you live. Let's take this step by step. Before we go any further, I want to say something plainly, and I want you to hear it without pressure, without hype. Choosing to follow this channel, Ever Young Seniors, isn't about clicking a button. It's about a mindset. It's a quiet decision that says, I take aging seriously. I care about staying independent. I want to understand what's happening inside my body, not just react when something goes wrong. Because the truth is, people who truly value their independence at this stage of life don't ignore guidance like this. They don't wait until a warning becomes an emergency. They stay a step ahead. And if part of you hesitates, if you think, I'll just listen for now, that's worth noticing. Because most people who lose their independence later say the same thing in hindsight. I didn't think it applied to me. Now, let's talk about the first category of medications. These are drugs almost everyone recognizes. Many people keep them within arm's reach. You don't need a prescription for most of them. Daily pain relievers, anti-inflammatory medications, taken for arthritis, for back pain, for knee stiffness, for the aches that come with a life well lived. They're sold over the counter. They're familiar. And because they work quickly, they earn our trust. But inside an aging body, especially after 60, these medications can set off a chain reaction that most people never connect back to the pill itself. Here's what happens. These drugs can cause your body to hold on to extra salt and water. That means more fluid circulating in your bloodstream. More volume your heart has to push with every beat. At the same time, they can raise blood pressure, sometimes subtly, sometimes significantly. And they interfere with how the kidneys regulate that balance between fluid and pressure. Your heart and your kidneys work as a team. When one is strained, the other feels it. A younger heart can often compensate. It has reserve. It can adapt for a while. But after 60, that reserve isn't what it used to be. The heart muscle is stiffer. The vessels are less flexible. The margin for error is thinner. This isn't speculation. Regulatory agencies have raised concerns about these risks over the years, especially with longer-term or higher-dose use. Yet many people take these medications daily without ever being told how they affect the heart over time. Let me tell you about someone who did everything right. Thomas, 73 years old, lives in Scottsdale, Arizona. He built a successful business, retired comfortably, and stayed active. Golf a few times a week. Long walks in the desert mornings, careful with his diet, regular checkups. He'd been taking a common anti-inflammatory for years to manage joint pain. It allowed him to stay active, to keep moving. Slowly, he began to notice small changes. His ankles seemed more swollen at the end of the day. He felt more tired than usual. Short of breath-climbing stairs, he'd handled easily before. Nothing dramatic, nothing alarming at first. By the time he sought care, his heart was struggling. The diagnosis was heart failure. When his medications were reviewed carefully, the connection became clear. Long-term use, fluid retention, blood pressure strain, an aging heart pushed beyond what it could quietly handle. This is why Ever Young Seniors exists. It's not for people who want to react after the damage is done. It's for adults who stay ahead. And here's a hard truth worth sitting with. Most people who end up blindsided later admit they ignored information like this when they first heard it. Now let's move to the second category: stomach acid suppressors. Medications often taken every single morning, sometimes prescribed for months, then years, then indefinitely. They're meant to prevent discomfort, to reduce irritation, and for many people, they do exactly that. But over the long term, especially in seniors, they can quietly interfere with something critical: mineral absorption. One mineral in particular, magnesium. Magnesium plays a key role in keeping your heart's rhythm stable. It helps regulate the electrical signals that tell your heart when to beat and when to rest. When magnesium levels drop too low, the heart can become electrically unstable. Irregular rhythms can develop. Palpitations, skipped beats, sometimes more serious disturbances. These medications reduce stomach acid, which the body needs to absorb magnesium and other nutrients properly. Over time, even with a good diet, levels can fall. Large observational studies have raised concerns about long-term use and heart-related outcomes. Not definitive answers, but enough signals to warrant caution and monitoring. Now meet Margaret, 68 years old, Naples, Florida, a retired professional who stays active and travels often. She'd been taking a stomach acid medication for years. It was part of her routine, refilled automatically. At a routine appointment, an irregular heartbeat was noticed. Blood work revealed low magnesium. She felt fine, no pain, no warning signs she would have recognized. But the connection was there: chronic use, silent depletion, a heart rhythm beginning to falter. This is how these issues often appear, not with drama, but with subtle signals that are easy to miss if no one is looking for them. And that's why informed longevity matters. Let's pause here for a moment. Not physically, just mentally. Take a breath and think back over the years. How long have you, or someone close to you, been using medications like the ones we just talked about? 5 years? 10? Longer? Most people can't even remember when they started. That's how normal it becomes. If any of these medication categories sound familiar to you, I want you to leave a comment and simply answer this: does this apply to you or to someone you care about? There's no judgment here, only awareness. And often, awareness is the first step toward protection. Now, let's talk about another group of medications that almost everyone reaches for without hesitation: cold and flu decongestants. These are seasonal, over-the-counter, marketed to help you breathe easier, clear your sinuses, and get through the day. They seem harmless, temporary, something you take for a few days and forget about. But inside the body, these medications are doing something very specific. They work by tightening blood vessels. That's how they reduce congestion. The problem is, those blood vessels don't just exist in your nose, they're everywhere. When blood vessels constrict, blood pressure rises, sometimes sharply. At the same time, these drugs can stimulate the heart, making it beat faster or more forcefully. For someone with an aging cardiovascular system, this combination can be risky. If you have high blood pressure, even if it's well controlled, if you have a history of irregular heartbeats, or if you have undiagnosed heart disease, which many seniors do, these medications can push the heart into dangerous territory. I've seen patients come in confused, frightened, asking why their heart suddenly felt out of control. The trigger? A simple, cold medicine. This is why awareness matters. Because taking your health seriously is a form of self-respect. And here's something worth hearing clearly. Ignoring short-term risks for convenience is how emergencies happen, not because people are careless, but because they underestimate how sensitive the aging heart can be. Now let's move to the fourth category. These are older antidepressants and nerve pain medications. Drugs that are still prescribed today, especially for chronic nerve pain, sleep issues, or mood symptoms. They can be helpful, sometimes life-changing, but they also interact directly with the nervous system, the same system that controls heart rate and blood pressure. One common effect is something called orthostatic hypotension. That's a sudden drop in blood pressure when you stand up. It can make you feel dizzy, lightheaded, unsteady. These medications can also raise your resting heart rate and interfere with the electrical signals that keep your heartbeat steady. In seniors, this combination increases the risk of falls, fainting, and rhythm disturbances. And this is very important. These medications should never be stopped suddenly. The issue isn't fear, it's monitoring. Knowing how they affect your heart. Adjusting doses carefully when needed. Let me tell you about Robert. 71 years old. Lives in Greenwich, Connecticut. He'd been dealing with chronic nerve pain for years. His medication helped him function, helped him sleep. One afternoon, he stood up too quickly and collapsed. His medication helped him function, helped him sleep. One afternoon, he stood up too quickly and collapsed. 62.8 sec. At the hospital, testing revealed a heart rhythm abnormality that hadn't been detected before. His medication wasn't the only factor, but it played a role. His heart had been compensating quietly, until it couldn't. This is where the conversation becomes bigger than you, because the people who rely on you, your family, your loved ones, they assume you're protecting your health wisely. They assume you're asking questions, staying informed, looking ahead. Taking care of your heart isn't just about you living longer. It's about staying present, independent, reliable. And that responsibility deserves thoughtful attention. When you step back and look at the full picture, a pattern begins to emerge. It's rarely just one medication. It's the combination. Multiple prescriptions taken together. Over-the-counter drugs layered on top. Supplements added in good faith. All moving through a body that has changed with time. As we age, the kidneys don't clear medications as efficiently as they once did. That means drugs stay in the system longer. Their effects linger. Their interactions grow stronger. At the same time, the heart itself becomes less adaptable. It doesn't bounce back from stress the way it did at 40 or 50. It compensates quietly, until compensation turns into strain. Each medication on its own may seem reasonable, approved, common, but together, over years, they create a cumulative risk that's easy to overlook and hard to reverse. That's why periodic reassessment matters. Not because something is wrong, but because your body is different now than it was when many of these decisions were first made. And that brings us to some questions worth sitting with, honestly, without defensiveness. If you were starting today with the knowledge you now have, would you still begin every medication you're currently taking? Or would you at least want a deeper conversation first and ask yourself this: has your medication list grown over the years without ever shrinking? For many seniors, the answer is yes. That's where Ever Young Seniors comes in. This channel exists for one reason: to support intelligent longevity, not just adding years to life, but preserving independence, clarity, and strength. A heart-first approach to aging, one that respects your intelligence and your ability to make informed choices. Think of this channel as an ongoing education partner, a place where we talk honestly about what aging really looks like and how to navigate it wisely. Staying informed is not accidental. It's a conscious decision, and choosing to stay connected here is part of that decision. If you choose not to, I respect that. But I would genuinely like to hear why. Leave a comment and explain what's holding you back. That kind of honesty helps everyone. And before we close, I want to hear from you once more. Leave a comment with your age and your state. I read these. Your voice matters here more than you may realize. Thank you for taking the time to think deeply about your health today. Thank you for respecting your heart enough to ask better questions. Stay curious, stay informed, and above all, protect your heart. Because informed decisions today shape the life you'll live tomorrow.